how do I optimize my natural fertility? Or how do I time things? Or should I be taking supplements? Or what testing should I have preconceptually? All of these questions can be answered, of course, by your OBGYN, but a lot of OBs don't have, an hour to spend with you to go over all of these details, and that's where a reproductive endocrinologist comes in. What I go through with all of my patients when we first meet is just the basic necessities of what it takes to make a baby. Normal sperm, open fallopian tubes, a normal uterus to implant, normal ovaries with normal numbers of eggs, and genetically competent eggs. We go through how to time intercourse, and we also go through things like preconceptual testing. So what should be tested before you even try to conceive, such as preconceptual genetic testing, looking for what we call recessive disorders, meaning disorders that if you are a carrier of this disorder, an example of a very common one is cystic fibrosis. So if you're a carrier as a patient of cystic fibrosis, it doesn't impact you or the baby in any way. But if both you and your partner are carriers, the baby then has a 1 in 4 chance of having that disease. And you want to know that before you get pregnant, because you have the opportunity to do IVF and choose embryos without that disease. Or even if you don't want to do IVF, just knowing that you will need invasive testing, just so that you're prepared when the baby is born. There's a really good chance of this baby having this disease and having everyone on board and prepared for it. Other things like checking to make sure your thyroid is okay. So we know that an underactive thyroid can lead to miscarriages potentially, and even problems with children later on with things like IQ. So you want to get that checked. You want to get your prolactin checked if you have irregular cycles. You want to make sure you're immune to things like rubella and varicella. These are all the things that we check preconceptually.